We've employed Alex, who's our first physician associate. He's working and spending a day a week working in each practice. We're looking at different ways in which he can support each practice, because each practice's needs will vary according to what their workforce is. So some practices already have advanced nurse practitioners supporting GPs with things like emergency on the days, requests from patients, but in other practices they don't. So we're hoping that he can help in those practices where they don't, look at that acute on the day need, and then in other practices he's helping look at things like nursing homes and how he can support with nursing home visits and those really acute care needs of those patients.
I think as general practitioners, potentially for too long we've been too cautious to allow other professionals and other healthcare professionals to take on some of our roles, but we all recognise that the workforce simply isn't there to perform all the roles that are need to be performed in the community. So getting the right person to do the right role at the right time inevitably is going to involve multidisciplinary team working.
Across the 4 practices I work at in Bollington, Disley and Poynton, majority of my day is looking after care in residential homes. A lot of the residents are older, may have some mental health needs, and other physical long-term conditions. The advantage of the physician associate and what I do in the practice is once a week I'll do a mini ward round where residents are able to let the staff know if they require a doctor's attention or if they've got any problems, and I can address those problems on a weekly basis, report all of my findings to a GP and escalate any severe cases if need to be.
The differences this has made for the GPs and the staff is that it really has released time for them. And there's 2 real benefits for that, and the benefits are very much as well for the patients and improving outcomes. So by having different models of care which do release GP time, it's allowed us to those GPs to spend more time thinking of proactively caring for patients that have got the highest risks and the highest needs.
Maybe get involved with a physician's associate training, have one for a small placement, see what they can do, see their interest and their enthusiasm, and see what potential roles that they can take off the hard-pressed general practitioner.
From a patient point of view, I think they really benefit from having someone see them sooner rather than later. I think there's a big demand and a lot of patients, and understand if they're in any discomfort or in any pain or if they're worried about an infection worsening, they get the attention they require at a sooner time.